Hi, this is Dr. Chan here at Crown Dentistry. Today we'll be answering some questions about why two dentists may recommend different treatment plans to a patient. So as we've talked about in a couple of previous videos, there's a really wide range of dentists out there in terms of philosophies, treatment philosophies, in terms of training, in terms of knowledge, in terms of experience. All of these things play a role in how a dentist is going to treat their patients and take care of their patients, how they're going to recommend treatment, what kind of treatment they're going to recommend. So all of these things play a role in treatment planning. And if a patient comes into their office and says, hey, I have this going on, you can talk to 5 different dentists and it's very possible that you can get 5 different treatment plans. Of course, as a patient, it's your responsibility and your challenge to try and figure out which of these treatment approaches are right for you. And so that's what we're going to be talking about today. One of the biggest differences that we see between dentists and how they recommend treatment or how they plan out treatment for you as a patient is the treatment that is being presented more on the conservative side, or is it more on the, I'm not going to say aggressive, but maybe proactive side. Basically doing treatment or doing more treatment versus doing less treatment, or maybe not doing any treatment at all. It's kind of a loaded question. It's kind of a complicated question, but we're going to try and dive into it. Sometimes in some situations, doing more conservative treatment is best. For the most part, here at Crown Dentistry, we try and do as little treatment as possible in order to take care of the problems and any potential future problems, but not so much that you're going to cause undue harm or trauma to the teeth or the mouth. Now that gets kind of complicated because there's a lot of different situations that may arise in the mouth, but by and large, that's what we try and do here. Everybody's generally familiar with some of the more basic technologies we have here in the dental office. One of the most common that most people know about are x-rays, right? Those are images and pictures that basically let you see stuff that's going on in the middle of the teeth, as well as things that are going on underneath the gums that generally you can't see as well with the naked eye. There's a lot of other pieces of technology that we have that also help us figure out what's going on in the patient's mouth. Some other things are intraoral cameras. That's basically a camera that goes inside your mouth and just takes pictures of your teeth and your gums and your cheeks. It puts it onto the computer screen, but it also magnifies it to a power of maybe 5 or 10 times life size. That's helpful because it can also show us some things that we can't necessarily see with our naked eye. Some other things that we use in the office are cone beam x-rays or computerized tomography machines. Those are things that basically take scans of your teeth and bone and hard tissue, anything that's in your skull and in your mouth, and basically puts it on a computer and then basically recreates bones in your teeth in the computer so that we can take measurements and do treatment planning in the computer outside of your mouth. Patients come in and they have their own goals for their mouth and their oral health. I think that's excellent. It's always good to have a goal. That's going to influence any potential treatment that you get as a patient, and it's potentially going to influence how I present treatment to you as the patient. If I know that someone's a little bit more interested in keeping their teeth, I might present one course of treatment that is more geared towards trying to save more teeth versus taking teeth out or maybe not doing treatment on teeth. It's our goal here at Crown Dentistry to try and save as many teeth as possible and try and keep as many teeth in your mouth as possible. The caveat on that is that sometimes that may require more treatment or more work, sometimes more time and money invested in your mouth, and sometimes that may or may not be something that aligns with your own patient goals. The most important thing is for us to communicate, and so that I can know where you're coming from, you can know where I'm coming from, and then we take those two viewpoints together and we try and find a common ground. So again, that's what we're trying to do when we're trying to figure out what your own oral health goals are. So there's a couple of things that a patient should look at when they're considering differing treatment plans from different dental practices. One is are you comparing apples to apples? You need to make sure that the treatment plans that you're comparing are the exact same treatment options. Like, for example, one dental practice may be trying to do fillings, and another dental practice might be trying to do some fillings and some crowns. So obviously those aren't exactly the same, which means that prices and time required in order to complete the treatment may not be exactly the same. So again, you want to make sure you're comparing the same thing. Also, you want to look at pros and cons for any treatment that's recommended. There are so many awesome treatment options that we can give you as dental providers, to you as the patient. There are pros and cons for each. There is no perfect treatment option. Everything has an upside and a downside. It's simply all about figuring out what's important to you as the patient, and also what your dental provider can do according to their knowledge and expertise. So that's another thing that needs to be considered when you're considering different treatment plans, is are the dental providers, the people who are actually going to be doing treatment on your mouth, the same? And that does take a little bit more research, a little bit more time and conversation, but it's really important. As we've talked about in other questions and other videos, trust and communication are vitally important to any doctor-patient relationship. When we have our patients come into our office, one of the first things that I try to do is I try to get to know them a little bit. One, because I think it's interesting and fun to figure out exactly what people are about and where they're coming from and what's important to them. But it's also important because it's going to impact how we take care of you as a patient and how potentially I alter or fit my treatment recommendations in order to best meet your needs. So it's really important that we communicate to you what our practice philosophy is. It's really important that we figure out what is important to you as the patient and what your own goals are. So basically we try to tailor and customize every treatment plan to fit you, so it's a personalized recommendation that fits you and your mouth. We do have patients that want the best for their mouth, and they basically try to go to different dentists to try and figure out something that works for them and what works for them the best. So I would say the most important thing is to talk to your dental provider or dental providers and figure out what they're offering you and maybe potentially what benefits you might have from going to one office over another. Again, it's really difficult just because, like I told you, there's a lot of dental practices out there. There's a really wide range of practitioners in terms of knowledge and experience and capabilities and technology. So I think the most important thing is to find somebody that you trust. So you got to talk to them. They got to talk to you. You got to let them know what's important to you, and they have to let you know what they can provide you as a dentist. So all of these things require time and a little bit of energy and a little bit of intention. But I feel like if those things are taken care of in the first new patient appointment, once you get that set, if you guys are able to get on the same page and we as dentists are able to figure out what's important to you, and you as a patient are able to figure out what we represent as a dental practice, then everything else will go a whole lot smoother. I hope we've been able to answer some of your questions today. If we can help you, or if you have any further questions, please give our office a call at 916-285-9678. We're here to help.